Good afternoon, everyone. Welcome to the third webinar in a four-part series by the University of California Center for Climate Health and Equity that will present on evidence and innovations to confront the climate health crisis. My name is Liza Hayes, and I'm with the UC Center for Climate Health and Equity. I'm pleased to kick off the webinar today. Our center's mission is to harness the expertise and leadership of the health sector to drive ambitious climate action for health and health action for climate. The center is based at the University of California, San Francisco, and spans all 10 UC campuses and 5 health systems with over 100 affiliated faculty. The center has 4 strategic work streams: research, education, health system sustainability, and policy, as well as special initiatives like our new UC Climate Change and Mental Health Council. I want to thank both the UCSF Office of Sustainability as well as the UCSF Academic Senate Committee on Sustainability for their support and contributions for this webinar series. Today, we'll be focusing on mental health and exploring how climate change impacts our mental health. We have one more webinar after today on Wednesday, June 14th. Our speakers will address how food and farming systems and its relationship to climate change. It's my pleasure now to introduce today's moderator, Alyssa Epple. Dr. Epple is a co-chair of the Center for Climate Health and Equity's Mental Health Task Force. She's also professor and vice chair in the Department of Psychiatry at UCSF. Additionally, she is the director of Aging, Metabolism, and Emotion Center. I will turn it over to Dr. Epple now.
Thank you, Liza. Thank you so much. And thank you, all of you who are here. We have an amazing group of participants, and we have 2 fantastic leaders in mental health and climate today. And we will have plenty of time at the end for discussion. So please be chatting in your questions. We all know that we're here because we know that mental health and climate is one of the most important topics right now. One of the hidden epidemics of the climate crisis is tremendous despair among particularly youth and young adults. And so we're going to go deep on that today. We know, for example, a survey published last year by Hickman and colleagues showed that among youth, really worldwide, 10,000 young adults, there was a high level of despair, as well as over half of them felt that humanity is doomed. I was just talking with a young adult who was telling me that they will not have children and their career choices are being determined really by their despair and hopelessness about the climate crisis. So that is exactly what we don't want to hear. The red flags are everywhere, and we need interventions at the community level, at the clinical level, and of course we need systemic change. So we're going to be addressing all of those today. Let me introduce our speakers. First, we have Elizabeth Pinsky, who is a pediatrician and child adolescent consult psychiatrist at Mass General and Shriners Hospital in Boston. Her clinical interests focus on the intersection of child mental health and physical health, trauma and resilience in medically ill children. She believes climate change poses the most urgent threat to our children at this intersection of physical and mental health, and that we must have a rapid effect to transition off fossil fuels. She's the Associate Director for Advocacy at Mass General Center for Environment and Health and a founding member of Climate Code Blue, Boston area climate action group for health professionals. Wow. Just a great example of someone who's integrated the urgency of this work into her work, as well as doing advocacy as a health professional. Secondly, we get to hear from Jyoti Mishra, who is I have the honor of co-leading our mental health council with our Center for Climate, Health and Equity, our UC-wide center led by Ariana and Tarani and Sherry Weiser, who are both here, who have made this all happen, have recognized the importance of mental health and have created a council where our role across the UC system is to make sure mental health is represented in our work in policy, in research, and in education. And Jyoti is the perfect lead for this because she's working as you'll hear, in all of these areas. She is a cognitive and computational and translational neuroscientist and the founder and director of Neural Engineering and Translational Labs at UCSD. Her lab develops digital and neurotech technologies that are accessible to diverse communities and can help address important issues, including psychological health and well-being. and resilience in the context of climate change. And Jyoti and I are planning a UC-wide class. We might hear a little bit about that today, that we are really crowdsourcing the strength of across campuses of both interest and expertise in climate and mental health. Jyoti's research is at the intersection of climate and mental health and regularly featured in media. Recently, Time Magazine, The Hill, Washington Post, World Economic Forum, and others. She was awarded the 2021 Varela Grant by the Mind and Life Institute for her work bringing mindfulness to climate education. Welcome, Jyoti. Now I turn it over to Elizabeth. So each speaker will speak for about 15 minutes, and then we'll have Q&A. Thank you.
Thank you so much for that introduction, Alyssa. I'm really honored to be here and thrilled to be co-presenting with Jyoti. So I've been given like kind of a big job, which is to talk to you guys about climate change and mental health, really sort of from a broad perspective. But I'm going to start by talking actually about how I got into this work and sort of how I got here. And it's actually kind of like embarrassingly late. It really was 2018 when I had kind of my climate awakening. And it was this report, the 2018 IPCC or UN report, that really got me. And I remember like where I was on my commute, walking home from the subway, scrolling on my phone, and I saw this headline: Major Climate Report describes a strong risk of crisis as early as 2040. And I had 2 little kids, and I immediately started to do the math. How old would they be in 2040? Where would they be in terms of, education and their sort of life stage and all of that? And I really kind of spiraled. I got incredibly panicked, was doing, sort of too much reading all at once, really preoccupied, waking up in the middle of the night, thinking about it. We got to move to Canada. And in the middle of all of this, sort of out of the blue, my son, who was 5 at the time, said to me, Mama, the earth can never die, right? It's like Santa Claus and it can never die. And I had no idea what to say to him. And I work with medically ill kids. I'm a psychiatrist for medically ill kids. I spend my days talking to children and adults about really difficult topics, and I didn't know how to help him with this. I knew what to say in the moment, but I didn't know what it was I needed to do or how I was going to help him sort of grow into adulthood in what I was increasingly realizing was going to be a really unpredictable future. And that was the moment which I said, you know what, I really wanted to recenter my professional efforts around climate and figure out sort of what were the tools that I had as a pediatrician and as a psychiatrist that could make a difference. And that's what brings me here. So we're going to dive in. I'm going to try really hard to get through this pretty quickly because I'm looking forward to having a conversation with all of you. But I'm going to have 4 take-home points. So the first one, I hope, is familiar to a lot of folks in this audience, which is that climate change is a human health emergency. Because I'm a pediatrician, I'm going to really pound the fact that I actually think it's mostly a child health emergency. We're secondly going to talk about the fact that mental health is one of the sometimes under talked about human health consequences of climate change. We're going to talk about the pathways through which climate change impacts mental health. Third, we're going to talk about inequity and, super importantly, the fact that while everyone's going to be impacted by climate change, those impacts are not distributed equitably. And fourth, we're going to talk about eco-anxiety or climate anxiety, which is a concept that I struggle with a little bit, but also think is important and we need to be thinking about how to move forward on. So, my slides to advance. All right, so our first take-home point: climate change is a human health emergency. And my guess is that for this audience, many folks are familiar with sort of like some version of this graph, the combination of hotter, wetter, less predictable climate, more severe weather, rising seas, dirty air. All of these things are impacting every organ system in the body. And again, as a pediatrician, what I would call folks' attention to is that in pretty much every one of these categories, children are impacted either more frequently or more severely. So you can pick any of these things. Heat illness, little kids, babies are less well equipped to regulate their own body temperature. Malnutrition, kids, particularly little kids, are more likely to experience malnutrition, and then it can have consequences, lifelong when it is experienced in childhood. Vector-borne illnesses are often more severe or more frequent in kids. I'm here in New England, and the incidence of Lyme disease up here is highest in school-age children. So in pretty much every one of these categories, I would say kids are most impacted. WHO estimates that over 85, I think 88% of the burden of climate change is borne by kids under 5. And to me, that includes the mental health consequences. We have less research, and sort of this is less well understood than the other human health consequences of climate change. But I'm going to argue that children are more impacted by the mental health consequences as well. So how does climate change impact mental health? There are a few different pathways. And today we're going to talk about direct impacts through heat and pollution, as well as the way that climate-related trauma can have mental health consequences. So first of all, the direct effects of heat and air pollution. We have a good amount of evidence that heat is associated with more severe symptoms of mental illness. So mania, suicide, violence, folks presenting to the emergency room because they're in psychiatric crises, all of those are more common when the weather is hotter. Even short of a crisis or some kind of really terrible outcome, we all know that we just feel cruddy when it's really hot. Heat impacts sleep, cognition, mood. Kids learn less well when it's hot, which is one of the reasons we need to think about how to keep our schools cool, sort of heading into this. And then separate from heat, air pollution is also linked to a bunch of negative neuropsychiatric outcomes. So anxiety, depression, dementia are all more common in folks who are exposed to a lot of air pollution. Really interesting to me is that that's sort of a chronic connection. People who live with more air pollution are more likely to develop those disorders. But even acutely on days with poor air quality, crisis presentations to the emergency room can be higher. And then finally, for folks like me who work with folks with chronic mental illness, really important to remember how incredibly vulnerable some of those patients can be, particularly to heat illness. And that could be because they may be at higher risk of being unhoused or have a hard time accessing cooling centers or air conditioning. But there also are actually direct biological reasons that folks with certain mental illnesses are less good at regulating their body temperatures. And then on top of that, a lot of the psychiatric medications that we use further impair people's ability to regulate their temperature. Beyond the direct impacts of heat and air pollution, there's a whole bunch of ways that climate-related traumas can impact mental health. And I like to sort of chunk these into acute exposures to climate trauma, chronic exposures to climate trauma, and vicarious exposure. So a lot of the evidence that we do have around this comes from the disaster literature. Folks look, we have evidence from Katrina and Maria and a variety of different severe weather events. And it's clear and perhaps unsurprising that in the aftermath of those events, higher rates of PTSD, folks are exposed to acute traumas like, life-threatening events, but also anxiety, depression, in communities where there have been severe weather events, increased rates of interpersonal violence and substance use disorders. And these outcomes actually can last over time. So we have long-term follow-up studies after Katrina, for example, that show that there's still rates of high PTSD in folks who experience that disaster. There's then trauma related to these sort of slow-moving catastrophes. So things like drought, famine, forced migration. And many of the outcomes that we see people experience after acute exposures to climate trauma are also happen with chronic exposures. But what I would say is that the more we learn about complex trauma, multiple traumas that are experienced over time, we know that those events are really cumulative. And so acute stress experienced over many months or years does have a cumulative impact on folks' well-being. And then finally, there's this vicarious exposure to climate-related trauma, which is what has gotten a lot of attention in the press. Alyssa was referring to this earlier. This is what gets called eco-anxiety. And a whole nomenclature has sprung up around this. Solastalgia is the experience of being homesick when one is already at home, but home has changed around them. And this would be, fear, rage, disaffection. Folks can have a lot of negative experiences related to vicarious climate trauma. We're going to talk about this a little bit more later. We'll go into more detail. So in all of these different ways, climate change can impact mental health. And again, I'm just going to pause and note that kids, young people, really are more vulnerable to these impacts. Some of that has to do with just like their biological and behavioral factors, right? They just depend on adults to keep them safe in a severe weather event, things like that. We also know that trauma, like malnutrition and a lot of other things, has more severe and longer term impacts when it's experienced in childhood. And then there's this psychological vulnerability, which again, Alyssa referred to, and we'll talk about a little bit more later. But kids expect grown-ups to take care of them, and the inadequate response that we're having to the climate crisis really causes sort of emotional distress. And then there's just temporality, right? Kids are going to be alive for more years of a hotter, wetter, less predictable world. So that brings us to the fact that while all kids are going to be impacted by climate change, not a kid born today will get through life without experiencing some impacts. Not all kids are impacted equally. So it's essential that we remember that climate change is a threat multiplier. So it's not just that communities or individuals who are already vulnerable due to systemic inequities like racism are more likely to experience climate-related traumas. Climate change then finds those vulnerabilities and makes them worse. So folks are more likely to live in a community that has vulnerability to extreme weather events, maybe more likely to have flooding or exposure to chemicals in the aftermath of a severe disaster, and then have fewer resources to be able to recover after such an event. And I always like to pause here and sort of point out that it is not just that climate change, is felt unevenly because of inequity, and it's not just that climate change makes inequity worse. Climate change is fundamentally a problem of inequity, right? It could not exist if we didn't accept that the people who are most responsible for the problem, who are burning the most fossil fuels, are least likely to experience harms, right? Intergenerational inequity, geographic inequity, and certainly racial inequity. And if this concept is unfamiliar or new to anyone, this essay by Hop Hopkins in Sierra Club magazine is really wonderful, and I would encourage people to take a look at it. But fundamentally, we could not live the way we do if we didn't accept that someone else was going to bear the consequences. So that brings us to our fourth point. And this is again about eco-anxiety or climate distress is the term that I prefer. I like this cartoon. This young koala has a mental health problem. So does that young koala have a mental health problem? I would argue that he does not. Climate anxiety is not a mental illness. Anxiety is an adaptive response. It's something that we evolved to have so that we can be aware of an oncoming threat and do what we need to do to prepare and respond to it. My own opinion is that climate anxiety or eco-anxiety, whatever we want to call it, is actually a sign of health. It shows that someone cares about the world, feels connected to the people and the animals that live on the planet. And I would really argue that it's a sign of health. That said, it is still a problem. So one of the issues with sort of the data and the literature prior to this study, and this is actually the study that Alyssa mentioned earlier, was that we had some data about eco-anxiety, particularly in young people. We knew that they were more worried about the environment and climate than their parents' generations were. We knew that people were worried about it, but almost all that data came from the US, England, Australia, sort of the global north. This study, which came out about a year and a half ago, was really important because it looked at 10,000 young people in 10 different countries in the global north and the global south. And what it showed us is that young people are incredibly worried and anxious about climate globally around the world, and actually are more worried in countries that are more likely to be impacted by climate change sooner and more severely. the take-home message from this study to me is what's in that green box there. So young people everywhere were worried about climate change. Those who felt most worried, most distressed about it, also believed that governments and adults, sort of the adults of the adults, had abandoned and betrayed them. So it was inaction on the part of decision makers that was most clearly linked to climate distress. And I will just throw these sort of thoughts up. What we saw before were feelings. These are the thoughts that young people had. And it's pretty distressing. I'm hesitant to have children. That's a finding that's been replicated in other studies. So what can we do to help young people cope? And certainly we will have some time to go into this possibly more in depth during the Q&A section. But what I would say is that perhaps the most important aspect, and this is for parents or for mental health professionals, is not to minimize young people's worries, not to try to recast them as, overreactions or catastrophizing, but to be curious, listen to what young people are worried about, and help them feel acknowledged and supported. Really practically, monitoring where young people are getting their information about climate and make sure that their media sources are good, and that they're not doom scrolling too much. That's one that I'm saying is for young people. That's for grownups too, in terms of managing your own anxiety. Doom scrolling is not a form of climate action. Specifically encouraging collective action. There's an adage out there, activism is the antidote to despair. And I actually don't think there's very good evidence to support that in general, but collective action, meaning young people getting together and working together as climate activists, it actually does seem like there's some real protective effect of collective action for climate distress. Cultivating healthy connections to nature, that's especially true for little kids. And then modeling healthy coping, which is a hard one, managing your own anxiety. That's what I did poorly back in 2018, when I think my son sensed how worried I was. And then finally, I would say, in the vein of climate anxiety is not a mental illness, remembering that our goal is not to not feel anxious anymore or to get rid of feeling anxious, but to feel less alone with it, to acknowledge and validate that this is scary. And then to foster agency and engagement. So that is why I think we do need to act on climate anxiety, and we do need to help young people with it, not just to make them feel better, because this is hard. We should feel worried, but to help people feel not panicked and not despairing, but to feel that they have the agency and the ability to make a difference, and to get engaged. And with that, I think we've hit our 4 take-home points. Health emergency, including a mental health emergency. Everyone is impacted, but not equitably. And finally, climate distress or climate anxiety matters, but it doesn't make you crazy. And so with that, I went a little over 15. I hope Jyoti will forgive me. And I'm going to let her take over to talk about a few more specifics to California and some of the research, and look forward to chatting with people afterwards.
Thank you. Thank you, Elizabeth. That was absolutely amazing. There will be a recording of this. And I just want to remind everyone, there's some great questions in the chat. Keep them coming while they're fresh, and then we'll get to discuss them after our second talk. And now we get to hear from Jyoti.
Thanks everyone for being here, and I loved Elizabeth's talk. She talked on a very broad scale what's happening with climate, and also especially about action, what we can do about it. And I've been learning about the field and doing work in the field for the past 5 years or so myself. And so I'm going to tell you about mental health and our changing climate, especially in the California context. So with this slide, I want to start by saying that we realize that we actually live in a limited and interconnected resource system, and our human security and livelihoods and mental health that stems from this is in this interconnected system that comes from the climate, our natural resources, and social stability around us. And then when we think about mental health, it is highly interconnected with our physical health and then our community health systems as well. Even despite climate, we know that a lot of the common mental health problems, such as depression and anxiety, are very much comorbid with cardiovascular health problems and other such problems, especially also acute problems like asthma and allergies can grow in the context of climate. And there's lung disease and other such problems that are comorbid with mental health. And when these problems, they are part of a social nexus that also involves our communities, the communities where we see mental health issues and where there is increased psychotic illness and heat-related stress can also increase community violence, as well as homicidal tendencies. They all increase and tend to degrade community health. So while today's topic is really on mental health, I want you to think about this as this highly interconnected system. When we think about our changing climate in California, there's very direct evidence to say that our California climate has gotten hotter over the years. And at the same time, the areas that have burnt with wildfires have also increased over the last 30 years. And this has been a systematic increase that's directly related to the human-caused warming that we're seeing. So there's direct evidence for the wildfires that are being seen, these events being accelerated by climate change. And what's going to happen in the future is also projected similarly, that more of the global land area and more of the human population is going to be exposed to deadly heat and potentially more of such extreme climate events. And so, you know, all of this as a scientist, I was really bothered by this as the rate of change of wildfires and such extreme events were increasing in California. And in this, as a scientist, I felt that it was my responsibility, especially as a mental health scientist and a neuroscientist, what we can do about this. So taking our communities and what's happening in our communities, one of the things that happened in 2018 was my son came home, and we're very active in local climate movements, and he came home with a penny drive. And this penny drive was to support a wildfire area up in Butte County. And they had recently suffered a fire. And it had the contact of the person who was doing the penny drive. And I go ahead and called them. And that started my journey into climate change and mental health work, of how I can, contribute to helping what's happening in this region. So when I was on my phone call with them, I was hearing a lot of distress and mental health problems coming up in this area. And when in 2018, we were not in this stage of accelerated wildfires that we have more recently seen in California. And what we knew was that natural disasters, like Elizabeth pointed out, do cause PTSD, depression, and anxiety. And these disorders are prevalent in the aftermath of such disasters. But what we didn't know is that when climate change accelerates these disasters and makes them of higher intensity and also more frequent, well, what happens to mental health in that context? And some of our work led to quantification of these specific mental health impacts. So we were out there in Butte County in November 2018, which the Camp Fire happened in this region. And I'm sure many of you may be aware of it. The Camp Fire is California's deadliest fire to date, with a massive area burnt and 20,000 buildings lost, 85 people perished, and 50,000 people evacuated as part of the Camp Fire. In this region, we see that these events are happening in these darker green areas, what we see here are regions that are also the most vulnerable health regions in California. So these regions happen to be at this wildland urban interface. They're at the interface where the wildland, the jungles, our natural reserves are right next to the communities living there. And so the major impact is being felt by the most vulnerable communities. Another point that Elizabeth brought up, that our frontline communities are the ones that are being most impacted by these events, and these are health outcome ranks of these communities. They are poorer as are defined by their physical environment and socioeconomic environment, and also by the poor health access that these communities get. So imagine these natural disasters accelerating these in the regions where there's already poor resources available to head on, deal with these sort of events. And so what we found actually was very alarming. We went into these areas 6 months after, so in a chronic way where there's no more smoke in the air, and at the same time the people are still suffering. We find that relative to a population that's not exposed to these fires, that's geographically further away from, say, the campfire region, we saw that people who are directly exposed to the fires, these are people who've had their own immediate property damage or have had family being affected, those directly exposed individuals had the highest rates of PTSD, almost 2 to 3 times what we see in individuals who are not exposed. And people who are indirectly exposed, that is individuals who are in the community but have not had direct impact, also have some degree of heightened PTSD, and same for depression and anxiety. Now this study was done 6 months after the campfire event, and since then I've also looked at data from the Carr fire, which happened in the Shasta region, and there, even 3 to 4 years out, we're seeing this greater propensity of and prevalence of PTSD, depression, and anxiety. So our communities, especially our most vulnerable communities, are really hurting in what climate change is doing to them. And here, what we see is that it's not limited. What we then went on to look at is the impacts beyond psychological symptoms. And so this is another study that we led in 2023, where we were looking at impacts on objective aspects of cognition, things that are not psychologically just feeling that you're feeling distressed. Well, is there something more than that? And so being a neuroscientist, I and my team went on to look at aspects of cognition and brain function, and to really show that these aspects can also be affected. And again, what we see here is that individuals who are directly exposed, this is an assessment of how distracted you are by the environment around you. So say you're trying to do a task, you're trying to focus on it, and there are all these distractions that are pulling you away from the task. And we deal with this, we're very familiar with this in our everyday lives. And what we see is that the people who are directly impacted by the fires or indirectly impacted, they had much lower cognitive scores, and then 20% lower than people who are not exposed. And so these are objective functions, cognitive functions that are being affected. And then we can also look at brain functioning in this context. And what we find is that the brain, you'll see this is a representation of brain recordings that happened with EEG data that this map is from. And what you'll observe mostly is that the directly exposed plot is very intense relative to the not exposed plot, or even the indirectly exposed people are always somewhere in the middle relative to this data. And on the right here is a subtraction between the directly exposed and the not exposed group. And what you see is this like hyper frontal intense activity. And that directly maps onto these symptoms of post-traumatic stress, where the brain is always overactive, it's hyper aroused, and it's constantly distracted by everything that's happening in our environment. And we feel that everything is a threat. And so when people describe the feeling, it's that the fire has long gone, but even if there's like a scent of burning from the stove, that sets off that same reaction, that same stress. And so the individual in this is in this state of constant hyper arousal. And this is happening in our communities, in our California communities at this very moment right now. And so over the years, since 2019 especially, the term climate trauma has come about, and it really has come about appropriately to define the mental health effects of climate change accelerated events. And really, while we're talking about vulnerable communities here, what we must realize is that if we do not do much about this, it's not long before we're all suffering from these same issues around climate trauma, and the way our brains function and our cognition functions is going to be impacted. Now, climate trauma, it's a very interesting term that's come about. It's something that is defined separate from PTSD, separate from anxiety and depression, but much more than that. And in its coinage, when Woodbury came up with it, it calls us as a trauma that defines us as not separate from the earth or its ecosystems and its climate. And within that context, what is discussed is that we're part of the problem. It's clear that the warming is anthropogenic, the 30 years of warming that led to the enhanced frequency of the wildfires that's brought about by us. And at the same time, we can be part of the solution. The climate trauma encompasses this idea that we are the traumatizer and the traumatized. What affects the planet affects us. And finally, it's a form of trauma that supersedes or intersects with other forms of trauma. So there's, again, something that Elizabeth mentioned, there's another layer of disadvantage for the communities that will be facing the worst of climate change, as we saw in the campfire study that we've led. And these are the same communities that have actually done the least to cause such climate change. And they will be the ones, they're the ones who've been dealing with, due to health shortages, high levels of non-climate trauma, and then adding on climate trauma on top of this is really unjustified. And so more needs to be done. What we're trying to build here is that by developing more evidence in this field, is that how climate trauma affects us mentally and impacts our mental health, it can also be leveraged, and we're asking whether it can be leveraged for collective climate action. So this is a very personal feeling that we get, that while at the same time we are traumatized, we're also in this cycle with the earth that if we change for the better, then we will feel better as well. So our mental health is highly interconnected in sort of a loop with what's happening to the earth. And so if we're causing damage to the natural systems, that's affecting us negatively. If we're able to change that for the positive, it will have positive effects on our mental health as well. And the silver lining really is here that there is still time for action, and why we need more science, public health science, as well as mental health science, is that this kind of science then leads to better communication, which then interacts with policy. And interestingly, a lot of this science communication policy network is also now very much involved with a faith alliance and talking to faith leaders who can then go into communities and make more people convinced of the climate change, the health impacts of climate change, and that we must do something about it. And in this context, climate education is very important. The most important thing we can do is talk to our children and our communities about climate change, bring it up more and more as an issue, and universities launching climate and health education. Alyssa mentioned that we will be launching a course around climate resilience and generating climate hope, while we're seeing all these distressing effects in our environment, and how to harness these effects on our mental health towards a positive collective action. We're seeing youth movements come up all around the world, especially in the UCs. At UCSD, we have a very strong Green New Deal movement. Private sector partnerships are very important. That's how cost-effective renewables are being led. And green energy policies worldwide have a huge role in mitigation. And finally, the solutions that we have to think about are nature-based. And something that I'll end with that I actually find a lot of inspiration is that these communities that have been completely burnt down to the ground, the campfire communities, they themselves are coming up and leading nature-based solutions where they practice nature therapy or forest bathing, the practice of mindfulness in nature within their ecological reserve environment. And people come together to practice a sense of calmness within the community, and collectively discuss their feelings about the environment and how they're connected to it. And in these sessions, they then go on to do ecological preservation activities. And so these are the communities that are most effective. And at the same time, when we engage with the frontline individuals, they're also the ones that are coming up with the most resilient solutions. And that I find extremely inspiring, and that we are now working with these community leaders to expand their efforts, and also to show the scientific evidence base for these nature-based solutions that our communities are leading. Okay, so I'm gonna wrap up over there, and what I wanted to summarize was that climate change accelerated disasters are having real and chronic mental health impacts, and understanding and acknowledging this climate trauma is very important to finding new solutions. And like Elizabeth also mentioned in her talk, a collective climate action is needed. Having collective action is actually, having that kind of social action is actually very good for our mental health. Being socially involved in problems that are related to our community is in itself beneficial for our mental health. And finally, I wanted to show you an example of grassroots nature-based solutions for collective healing. So the communities that are most impacted are not giving up. And so our message is that we must not give up, and have us all join the movement. And with that, I'll end with that. Thank you.
Wow, thank you so much, Jyoti and Elizabeth. That was amazing. We have a lot of questions, and I will call your name if you want to appear to ask your question. Feel free to, otherwise I will read it. So there's so much to talk about, and we have 15 minutes, and you're the perfect people to address these big, heavy questions. I'm going to start with David Cleveland from UC Santa Barbara. David, do you want to come and ask your question live?
Alyssa, if you don't mind reading the question,
okay, I'll read it. What do you think of the argument that youth and over-consuming populations not wanting to have children is an adaptive response to climate change, since the fundamental cause is excess people, impact on Earth systems driven by human consumption? So how do you view that, youth deciding not to have children?
I'll take a stab, Jyoti, and then if you want to take a stab, you can as well. I guess what I would say is that a little bit gets at the question of sort of individual versus collective action. I very much reject the sort of false dichotomy that there's individual action and there's collective action, right? Collective action is a whole lot of individuals doing something together. I would support anyone's individual choice around reproduction, obviously. And also, I fundamentally believe that the fossil fuel industry and the systems that exist are the problem, not anyone's individual choices. So certainly, I think choosing to have a child is a complicated decision. And someone factoring sort of one's own feelings about the future and concerns, you could do that related to climate. You could do that related to a lot of other things. I certainly wouldn't, as a friend or a parent or a clinician, wouldn't want to dismiss anyone factoring something like that into their decisions. And it's an incredibly complicated question that there have been some excellent books written on. So that's what I would say. I don't know what you would say, Jyoti.
Yeah, I think my thoughts are similar. These are individual decisions that one should respect. And I think individual decisions also change over time. We're living a longer lifespan, and we're seeing, women making the decision to give birth into their 40s, 50s, and we don't know, these youth may have a difference in their thinking if we are able to create a hope for a better future in a decade, if we're able to really bend the curve and move the trajectory in a positive way. This same generation may have a more forward and optimistic view of bringing in the new generation, but I respect their individual opinions right now.
Thank you. This next question is another hard one. What advice do you have for climate warriors who are horrified by the World Meteorological Organization's prediction of 1.5 Celsius degrees increase by 2027? So that is probably one of our more dramatic and dire predictions of immediate warming. The question is, how can we not give in to despair while being realistic about this enormous challenge?
Do you want to go first on that one, or you want me to take a stab again? I mean, that again, is it, oh, where are you going to go? That again is a broader question. I agree that is a particularly horrifying headline. There are many horrifying headlines out there. It is a broader question about how do we balance hope and despair, and that's really what the question is, right? Like, the question isn't should we be climate anxious. The question isn't like what should we do about climate anxiety. The question is how are we going to balance despair and action? And there's a lot of different answers to that, I think. One answer is that you dip in and out, and that you have some days where you have a harder time accessing hope, and then other days where you have an easier time accessing hope. And then all of the advice that we already give people in terms of coping with difficult climate emotions, including finding a community. And I would say that in the face of any of the sort of horrors that we hear about in climate change is the thing that I think is most important, is finding a community of like-minded people who want to take action and build community and make connections moving forward. In my most hopeful moments, in my like sort of cheesy 115 people left here are going to make fun of me moments, I wonder if collective action and connections around climate could be the thing that actually provides solutions for a lot of other difficulties in terms of loneliness and disconnection and things like that we're dealing with. And the only way to find out is to go forward. But not an easy question, so not a perfect answer.
Yeah, absolutely. I think, when people talk about climate resilience, there's three pillars. One is mitigation. One is adapting to the heat risks and the disasters that are about to come, the adaptation. But the most important piece is the social transformation piece, which is really building a bipartisan and massive public movement that's and that's going to be led by these climate warriors. So we need this hope to live on, and that's how we make the positive change. And being, that's contributing to the solution in your own way is what is also a remedy to the mental health, to your own mental health. And we're not going to be able to get the 1.5C down in the next few years, but we're trying. The pan has heated. If the analogy is that if you shut down the stove now, it will feel hot for a little bit more. But if we do shut it down at some point, it will finally be at a temperature that humans thrive in. And so it doesn't feel like we're in a place where we're making a positive change. But if everyone together feels that way and moves towards a solution, I think that's where the hope is. And anxiety, like Elizabeth also mentioned in their studies on this, anxiety is actually a positive stimulator for action. And so it's good to have that anxiety.
Mm-hmm. Yeah, lovely convergence among both of your perspectives and suggestions on collective action for youth, as just the critical nature of how can we provide these structures for them to be getting the support they need and working together. This next question is about, really relevant to this group and audience, which is, what research do you think is most important now in mental health and climate? There have been many studies already documenting levels of eco-anxiety. Are we at the beginning of that? Do we need a lot more? So the exact question is, do we need additional research into eco-anxiety and PTSD? And if not, what do you want researchers to focus on? What do you think is most needed and compelling?
Yes, I think I can come to it from, I'm a translational researcher. So this means that we look at things in a circle. We need to understand what's happening at the baseline that we have right now. Before us, the evidence would have been anecdotal in terms of how is climate change impacting mental health. It wasn't well quantified until the few studies that came up in the last, building up over the last decade. So they've set up a really urgent baseline for helping us understand that when we go in with new solutions, with new, either it is mitigation, adaptation, or action, collective action, social movement focused, how are the research that we've done until now is formative, and it's key towards understanding which solutions are helping. But I agree that the focus needs to be more on solutions and community partnered solutions, not just a broad policy that this is how we're going to, a green policy that's going to be a blanket policy. That's not usually how it works. Every community needs something that's tailored to them. And so working and listening to our community partners and figuring out what their needs are and how to systematically and scientifically implement those solutions, especially for sustainability over the long term. And then seeing whether mental health is actually improved in that context. So showing evidence for that then itself helps with better policy making going forward in the future.
Beautiful. Okay, well, we have, in our last 5 minutes, let's focus on policy and system changes. There are a few last questions here that are wondering about, we have this mental health system that's in tatters, and then we have a separate silo of climate work and climate activism, and how do we bring them together? So I'll read a specific question. How do we achieve successful cross-sector work between climate and mental health? What do you suggest to bring climate into the conversation for people who are planning mental health programs and services and who control resources? It's a hard question. Just take a stab.
I would say that one pretty, so agree, we're siloed, agree that the solutions that we need in terms of mental health for climate are going to be different and transformative and not the model that we have had for many years of like individual client, individual service, like given in an office, right? We're going to have to think much bigger and much more broadly than that. One really basic thing would be, let's get climate education into the curriculums of psychology, social work, psychiatry. Like, let's get climate conversations just into the training programs. Vast numbers of programs, this never gets mentioned at any point. So that would be like one really simple intervention that's important. But then I think this actually gets back at GOT's really good answer to the last question about how we are going to need, like, this is not about individual trauma. We are all going to be experiencing individual climate trauma, and it is neither an effective nor an efficient intervention to help individual people, right? We need to be thinking about community trauma and societal trauma. And so there will be, I hope, really transformative and very cool ways to help people collectively deal with this stress that ultimately will also promote climate solutions, because a community that is traumatized cannot engage in climate solutions.
Yeah, I think there has to be a constant dialogue between researchers, communicators, and policymakers. This is very urgent for our most vulnerable and frontline communities, where these kinds of cross-sector conversations are happening, and scientists go to the hearings in Congress to talk about what's happening with mental health and health in the context of especially wildfires, and how to protect these communities. So this is happening in specific context, and then more broadly, we understand that there are ways to scale mental health solutions through peer supporters, through lay counselors. And how do we bring that model that has worked really well with global health into climate health work, where we can support each other's distress in the context of climate? And that overall is going to be most supported by education, that everybody realizing and acknowledging that climate trauma occurs, and that we need each other's support for it.
Mm-hmm. Yeah. Thank you so much, both of you. And I hope we can continue this dialogue, especially on, in a year, on this last point of great examples of how people are doing this work in the community. And both of you are such inspiring role models. Thank you. And now a word from our sponsor, Sherry Weiser, who's the founder and director of the Center for Climate Health and Equity. Thank you.
Yes, and I will be very brief. I just wanted to thank our speakers and moderator for a really engaging and wonderful session. I wish we only had much more time to cover all the excellent questions. Just for those of you who don't know, the webinar was recorded. and we'll be sharing the recording with you soon. And please register for our upcoming webinars. So the next one is on June 14th on food and agriculture. So thank you all very much and have a wonderful day. And we'll stop there.